afternoon. We're here at the Barrow Regional Medical Center in their laboratory, and we're going to take a little tour of the lab, talk to Dr. Lancia. He's going to show us around. We're going to discuss a few things, look at some samples of some nasty stuff that Statham took, and then we'll give you guys some time for some questions and answers. So right now, what I'll do is I'll flip my camera around, and you'll get to meet Dr. Lancia. It's already on. Hello. I don't know if I check. Hi, my name is Dr. Lancia, and I'm going to be taking you around Barrow's lab today. If you have any questions, I will answer your questions. If you see anything that you want to ask more about, I believe your teacher can help direct questions to me, and Mr. Bain will help as well. But we're going to start with a general tour, and then we'll do questions towards the end. So we're going to start, this is the front of the lab over here. This is where people would come to have their blood drawn, right? This is the waiting room. This is where we keep all of our samples when they come in, here to the left. When we receive a sample, and if you've ever had your blood drawn, which many of you have, they put it in a little tube, right? Little tube. This has a blue fluid in it, not somebody's blood. So the needle part goes in this side, and it actually pulls the fluid into the tube. So when we receive your blood in the laboratory, it has a note from your doctor, and it tells us what tests to run. Sometimes we have to prepare and get the blood ready to be tested. So some of those require us to use what's called a centrifuge, which is what these big machines here are. It spins the blood around in a circle and separates it into parts. So here's where we put our tubes. There's the tube. It goes into the machine, and then this machine spins it around in a circle and separates the blood out into different parts, the fluid part and the cellular part. And then from that, we can test a very wide variety of different things in your blood. So blood testing is one of the main things we do inside the laboratory. Another thing we do is we test body fluids. Sometimes if little kids get very sick and they have meningitis, which is inflammation of the fluid in your head, they have to take that fluid. Sometimes we have just urine specimens from people who have infections. Sometimes people have swellings in their joints, and those fluids can be taken. All these fluids can be tested in the laboratory as well, but the one that we do most is blood work. So over here is more of our fluid testing. Some of our instruments. Here's a microscope. We'll get to see more of that kind of stuff in just a few minutes. As we move around to this side, this is sort of the center of the laboratory here. There's two big machines here, side by side. So after we prepare the blood, these machines do a bunch of different tests. So we'll put the blood specimen into a small container. I don't think any of these are out just right now. Not yet. We'll put the blood specimen into a small container, and then we'll put the container onto the instrument and then tell the instrument which test we need it to run. So you might need to have 2 or 3 different blood tests run. Maybe your sugar is too high or too low, so they want to test that. Maybe you have dehydration and they want to test your electrolytes. We can test all of those things from one blood sample on one machine. So this is our chemical analysis for blood, and over here, we're moving kind of quickly, I'm just trying to give an overview. Over here we have testing for different types of blood cells and how well your blood clots or coagulates. So over here is our little blood tube rack. And again, you can see, this one is actually a good example. You can see the red at the bottom and sort of the tan colored fluid in the middle. So this specimen, it doesn't, your blood doesn't look like that when it's inside your body. It looks like red. But then once we spin it around, it separates and it pushes all the red blood cells to the bottom, and it keeps the serum, or this tan-colored fluid, near the top. We do that to separate it out so it's easier for us to test. So in this case, we've separated it all out. And over here, we're using the microscope. I don't know if we're going to be able to see that or not, but you can see that this is a slide, and we've smeared some of the person's blood right onto the slide, right? And then we take the slide and we put it onto the microscope, where we can actually look at the red blood cells themselves. Mr. Bain, do you have a picture you can easily switch to for that?
Sure.
So here's a picture of what we would see in the microscope looking at the slide that I just showed you. All the tiny sort of pink round spheres covering the entire surface of that slide are red blood cells, individual red blood cells. Directly in the center of the field, which I don't know if we'll be able to highlight. Let's see if we can highlight it. Right there, that right in the middle is what is called a neutrophil, which is a very specific type of white blood cell that helps your body fight off bacterial infections. So as we look around the slide, we can see all the red cells, we can see all the different kinds of white cells, tell if there's too many or too few, if they're the right shape, if they're the right size. And so that instrument, the microscope, helps us to see all of that. The other instruments that we have over there help us to count the cells, and on the other side, it helps us to say if the blood is clotting or is having trouble clotting. Some people, when they get hurt, their blood doesn't clot very well and they don't form scabs like the rest of us. That can be caused by some people's medications or in some cases certain diseases, but that instrument will help us measure how well your blood is clotting. We're going to keep moving. This is some storage for all of our instruments, right? You can see all the different type. These are all different chemicals we use to do all the blood testing. We have to keep them in the refrigerator for kind of the same reasons that you keep milk in the refrigerator. We don't want it to go bad. As we move around, we do some of our strep throat testing, some of our mononucleosis or Epstein-Barr virus testing. We'll come around this way. If we have a doctor who has a patient who's very sick and he doesn't know why, and he orders many tests, and that patient has their blood drawn, and we receive it here in the laboratory, sometimes the doctor has ordered a test that is so special that we don't have the right stuff to do it here in the laboratory, and we have to send it away to Emory or to Athens or perhaps even to another state. And that requires us to package everything up just right and make sure all the paperwork is just so that everyone has all the pieces they need to do the right test, and so that the right person gets that right answer back. And so over here to Mr. Bain's left, this is where we set up everything so that it's all sent out to the right place, so that it comes back to the right doctor and the right patient gets the right result. We're going to move on. We're going to do the blood bank next. So the blood bank is what we call it in the laboratory, the blood bank. It's where we store all of our blood units. It's where we do testing to see what kind of blood you might have. And as you can see, we have a sign on it because we don't want people to store their lunch, right, in the same refrigerator. And it's just a refrigerator with many shelves, and on each shelf we'll have units of individual donations, right? So this is red blood cells. Can you get a good shot of that? Yeah. So those are the red blood cells in the package, right? And on the front you can see it has a big letter A and RH positive. So each one of these units, we know who it came from, we know what kind of blood it is, And we have all kinds: A positive, A negative, B positive, B negative, O positive, O negative. These are all different kinds of red blood cells. We have to do a lot of testing to make sure that if you have a very special kind of blood, that you also only receive that kind of blood. If we give you the wrong kind of blood, it can be a big problem. And in some cases, it can even cause people to die. So we make sure very, 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 very certain that we only give you the right kind of blood. So we have, all these are labeled very clearly, right? And then we have a logbook where we write down all of our testing in all these fancy columns, right? You can see all the columns that we do. And we measure all of these different types of blood. And we try to make sure that only your type of blood is given to you. We don't want to give you the wrong kind. We certainly don't want you to have any more problems. There's many reasons why people would receive blood, but in general, they're already very sick. And we don't really want to give them any more problems than they already have. So it's an area where we try to keep very good records. We make sure everything is labeled very clearly and make sure it's all done just right. So this is our blood bank. This is where we hold all of our blood units. These are the ones that have already been donated, and now they're waiting to be given to someone who's in the hospital. This is our freezer right next to it, which holds some of our plasma products, which are also from the blood, but they require to be frozen, so we put them in a freezer. Let's move on. We'll show you microbiology. So all the way in the back, just in our lab, not in every lab, all the way in the back, this is where we do our microbiology testing. So people who get bacterial infections, sinus infections, pneumonias, all sorts of different types of infections in the hospital, the doctors send their specimens here, and we test it to see what kind of bacteria is causing their sickness. So it might be from someone's blood, it might be from their nose, it might be from something they coughed up, could be from anywhere, could even be from on their skin. We can test it and we can grow it. And I know that you all have used some of these plates. Let's see if I have a good one here. I don't know that you'll be able to see much. If you get it just the right angle, you might be able to see the streaks. This one's not really growing anything right this second. You might only be able to see the faint streaks on there. But this is what it looks like when it's not really growing anything. Some of the plates that I saw pictures of from your classroom are growing quite a few things. So we keep a hold of all of these. We keep them in this is kind of the opposite of a refrigerator. This keeps things warm, because bacteria typically like it a little bit toasty. So we keep them warm, we let them grow, and if they do grow anything, we will put them onto a special machine, which is right now covered up for us, but we'll put them onto a special machine that tells us exactly what kind of bacteria it is and what drugs would kill that bacteria the best, so that your doctor knows what it is and what antibiotics to give you. Sometimes that can take some amount of time. It doesn't always happen in 24 hours. It might take 2, 3, 4, maybe even 5 days for us to grow the bacteria and to test it and to give your doctor the right result back. So it can be a little bit time consuming. It's not very fast. Some of the newer testing that we're developing in medicine doesn't require us to grow it. It just tests the DNA of the bacteria. Those tests are a lot faster, but they're also a little bit more expensive. So we don't have any of that here. We still grow it and then test it on the machine. So that's our microbacteria and fungal area. As we move around, this is the last specimen area that we have here. And some of that actually has some patient information, so don't take a direct shot. But this is where if someone has a tumor, or maybe they have a spot on their skin that their doctor is worried is cancer, and they take a little biopsy and they have to send it to the laboratory. We test that here as well. And so they will typically send it in a little bottle, right? They'll put it in a little bottle just like this, and they'll send it to the laboratory, and we will process it. And let's see if I have an example. We'll cut it up into tiny, tiny pieces and put it onto a slide. Let's get a picture that way, maybe you can see it a little bit better. Put it onto a slide. And again, I will be able to look at the slide and then tell if there's any problem with the biopsy that they took. Sometimes people have to have big surgeries for cancer. And so we take little pieces of the tumor and we tell the doctor exactly what kind of cancer it is so that it doesn't spread, or if it does spread, how they're supposed to treat it. It tells them a lot of information once they know what kind of cancer it is. And so this is how we do it. This is the area that we do it in. So it's a little bit of a small lab, but it has a lot of different functions. We don't do as much as some of the bigger hospitals, right, that you would find in the really big cities, but we do all the basics. And so even in our small area, we do quite a bit. And not across any of the techs, but right now we have 2 technicians and 2 phlebotomists. And a phlebotomist draws blood, and our technicians help work in the laboratory, working with the equipment and doing the individual tests. So that's kind of our brief overview. I don't know, is there anything else we need to cover, or are there questions? Yeah.
So with Ms. Hockaday, that's Ms. Hockaday.
Ms. Hockaday, do we have any questions? Turn it on.
Do you have any questions for? No, we don't have any questions at this time.
Okay.
Let's go with Ms. Black.
Ms. Black, are there any questions? We can cover questions from any area.
What's your question,
Like, do they do it for most patients, or
Do they do what? Most patients,
like take all the patients' blood?
Yeah. Does every person in the hospital have a blood sample, right? Does every patient have a blood? It's not required. But the thing with the hospital patient is if you're in the hospital, you're pretty sick. And so because you're pretty sick, your doctor will probably order a blood test, but it's not required.
There's a question from Ms. Payne.
Oh.
So, Ms. Payne, if she could get some of that.
Ms. Payne,
All right,
is there
Savannah.
a question?
What was your question, Savannah? Loud.
Have you had any really, really bad bacteria?
Bad? Really bad bacteria?
Yeah, have you had any really, really bad bacteria?
Yes, there have been a few terrible bacteria. And I've only been at this hospital for a year and a half. And in that year and a half, there have been 2 really bad bacteria. One was a man's leg because he got a cut on his leg, a really bad cut, not a normal cut, really bad cut. That really bad, deep, deep cut got infected, and he didn't go to the doctor, and he didn't he didn't even really wash it up very good. And it got infected, and he just let it go. And so by the time he came to the hospital, it was already really bad. So it took a long time for him to recover because the bacterial infection was already advanced. It was already bad when they caught it. But not many, maybe 2 in the last year and a half that were really terrible. Many times, even though it might be a terrible bacteria, we catch it really early. And because we caught it very soon, we're able to treat it and get rid of it before it causes a really big problem.
Another question was, what is the most common bacteria that you guys have to deal with?
Most common bacteria that we deal with. There's 2 groups. People that come to the hospital with infections, they show up with an infection. The group is a very common community. They get the bacteria out somewhere at the store, at their house, or at their swimming pool, or at their high school, or at their grade school, wherever they're at during their day. And those groups are a bug called Staphylococcus aureus, or Staph aureus. Some people just call it staph. It's a very common skin infection. It's found in actually quite a few people. And so it's also common to have it cause an infection. Inside the hospital is that's someone who comes to the hospital for some other reason and gets an infection while they're at the hospital. That group is very small. There are not very many people who have that happen. But when it does happen, on occasion, it is also aureus, the same bug that causes the problem on the outside, but can also be a different kind of bacteria called Klebsiella, which typically causes pneumonia. So those are kind of the two big groups that we see.
Ms. Payne asked her own question.
Ms. Payne, was there another second question?
Yes, we have a few questions. Ben, what was
Okay.
What happens if a bacteria cell and a cancer cell somehow mix? And
If they mix.
Can they mix? If so, what happens?
Right, so a bacteria cell and a cancer cell, they won't join forces. They don't on the same team. Cancer cells they're bad, but they do their own thing. And bacteria cells, they're not necessarily bad, but they definitely also do the thing. They don't really team up. They don't mix in the sense that they don't join. They don't become the same. They're always separate. And the cancer cells don't attack the bacterial cells. Bacterial cells don't attack the cancer cells. So they're usually separate. If someone has cancer, it can have an infection in it, but they're not joining forces, usually because of the treatment that the cancer patient is receiving. This might be a little bit complicated, but it's because of the treatment. It knocks their immune system down, and then the bacteria start attacking them because of the chemotherapy. So the bacteria and the cancer cells don't team up necessarily, but sometimes they can cause problems together. So cancer cells and bacteria cells absolutely require two very different types of treatment. So for a cancer cell, we would give you one kind of medicine, and for a bacteria, we would totally different kind of medicine. Did we get all the, I think she said she had, okay, we'll go back, okay. Ms. Hockaday, was there another one?
We had a question about the importance of getting shots because some students don't like how it hurts when they get a shot, but I try to explain sometimes it's better to get the shot than to get sick.
Yeah, and I'm getting over a cold right now. It is definitely better to get the shot than to have to lay in bed all weekend with a really bad fever. Because so the vaccination, the idea is that we give your body a little taste, a little small piece, a little piece of evidence that it should look for, so that when it sees the real virus, right? You might be out playing with your friends and someone coughs on, you might be at the mall with your parents, someone sneezes and gets it all over you, right? That gets that virus all over you, which is also why it's important to wash your hands, P.S., because you wash it off. So wash your hands, sneezing, try to cover it up, don't cough and sneeze on other people. That's how these viruses get transmitted from one person to the next. We give you the vaccination so that your body gets to study ahead of time so it knows what the virus looks like. That way when someone does cough on you or sneeze on you or however it is that you get it on you, your body already has studied ahead of time and knows what it looks like, and it can fight it off a lot faster. If you don't get the vaccination, your body doesn't get to study ahead of time, the virus will get on you or it infects your body, and your body has to learn. It takes some time for your body to kind of learn that it's a virus before it can start fighting it off, and that's ultimately why you feel sick, because you didn't let your body have that time to prepare itself. Ms. Hilly, was there a question about E. coli?
Yeah, we aren't fifth grade, we're fourth grade, so we haven't learned
Fourth
about
grade.
we haven't learned about cells, but we're doing a mystery disease unit, and we have
Okay.
found out that our county has been infected by E. coli. So we were wondering if you had dealt with E. coli and you could tell us anything specific about E. coli.
Yeah. E. coli is a very long foreign sounding name, Escherichia coli. It's a very tiny organism, very small. It consists of only one cell, one single cell, right, is a bacteria, as opposed to a human, which has many, many trillions and trillions of cells, right? It has just one cell. So it has in a group. It has to team up with its other E. coli buddies in order to cause any problems. It's a very common, in fact, most people have it somewhere in their intestines, okay? Sometimes it will cause an infection. Or if it gets in a place that it shouldn't be, it can cause symptoms, problems, that we then have to use an antibiotic to treat. An antibiotic is the name of the drug that kills it. So it's a very common, and in the hospital, we do see it many times in urine specimens, bladder infections, kidney infections. E. coli is a very common bug in the laboratory. It's also common for us to test it to see which drugs kill it the best. So if someone that you knew had a bladder infection and they came and they went to their doctor and the doctor sent us a specimen, we would test it. Oh, we found E. coli. We would say, call your doctor back and say, we found E. coli. Here's a list of the drugs that are really going to work well to get rid of it. And then he would call your family member back and say, all right, here's what it is. It's an infection. Go, this drug for this many days. Go away. And so that's how, in the laboratory, that's how this works. Outside of the incubator where we grow all the bugs, we don't have E. coli anywhere in the lab. It doesn't lay on our countertops. It doesn't sit on the floor. It doesn't live on places like sinks. That's not where E. coli likes to grow. So it's typically human to human transmission. Sometimes you can get it, but it's very uncommon that way. So it's it can contaminate drinking water, but because in Georgia they do a good job with the drinking water, we don't have any problems like this. Do we have another one? Miss Payne?
Were
Do we have
you
a follow-up?
were you able to identify, just by looking at the pictures of our bacteria, anything that we were growing from around our school?
Yeah, not down to an. If Mr. Banner will pull those up, we'll be able to look at a few of those here in just a minute. We will identify down to a specific name, although you tell just by looking at the plate that there are different kinds of organisms growing. So it looks like there are 2 or 3 different fungi. Some people would call them molds. And it's a little bit hard to tell, but it looks like 1 or maybe 2 different kinds of bacteria. Let me see if I can. Looks like gym floor. So this is the Petri dish, very similar to the one that you saw in my hand earlier, but this one is growing all kinds of good stuff. Some of these are, So some of these, like this spot right here, it looks like smooth and maybe shiny, glossy. I can't really tell on the picture there. Some of these look more like they have hair. This guy over here, like this white color looks like he's kind of furry or hairy, right? There's one here which looks kind of black or dark brown in appearance, like this group and this group right here. Maybe this guy over here. And it looks like this could be new. I'm not sure what this is over here. It's hard to tell on the picture, but he looks more yellow. And then down here at the edge, which I'm not really sure it's a contaminant or not. I was off the gym floor, who knows? That looks like a fungus. So to a specific name, no, I can't right off of that pick it out. I can tell you if we saw something else in the laboratory, we would take a small little tool and scrape off a little bit of each one of those colonies and put it on its own plate and grow it up all by itself. So because we had, what, maybe 4 or potentially even 5 different things growing, we would try to grow each one on its, and then test it from there. Yeah. Looks like all kinds of different fungus. And some of the stuff, it is important to know that just because we grow it on a, I think those are potato auger, yeah? It looks like potato auger. Anyway, just because we grow plate doesn't mean that it actually causes disease. So there's lots of bacteria and even fungi on occasion that grow in your body that don't cause, in your intestines, there are thousands and thousands of different bacteria all growing in your intestines that don't cause you any problems. The problems are when we get bacteria, they shouldn't be. They should be in your intestines. They should be there. So a place where they shouldn't be, that causes problems. Or if there's a specific kind of bacteria that's really bad, that shouldn't be anywhere, right? So there's 2 times when it causes disease. When it's a normal bacteria that got somewhere it shouldn't be, or it's a bad bacteria that should never be anywhere that somehow got in there.
And when you grow bacteria in the lab, does it look similar to what they?
Yes, some of the stuff that you have on those plates is fungus. And so we wouldn't, you know, the plates that we use, which I'll show you quickly. So we have a little bit different plates. I'll see if you can maybe see the color better if I put it up to a different, that's kind of a pink or a purplish hue, right? Not quite the same color as your, I think, potato auger, which is more of a brownish color. And then this one, which is obviously much darker, right? Red. See pink?
That's not blood, is it?
Pink and red. This one is blood. This one is not blood. So we have different kinds, right? Different kinds of auger. So when we put it on a plate, depending on the type of auger, some will grow bacteria, some will grow fungus better. Some of them are so special, they will only grow certain types of bacteria. So when we put it on a plate in the laboratory, it won't look like what you have because what you have grows everything. The kind of auger you're putting it on will grow everything. Fungus, it'll grow fungus. If there's bacteria, it'll grow. In the laboratory, we want to be able to pick out one at a time, so we use different auger. But if we took what you have in your classroom, it would look very much exactly like what you have on plates. Okay, Ms. Black, I see we have 2 questions.
What was your question?
Is there more germs in a hospital than outside?
Is there more germs in a hospital than outside of a hospital?
And the second question?
What would happen if you had bacteria in your heart?
Both are good questions. Are there more germs? We'll do the first one. Are there more germs inside the hospital or outside the hospital? Just by sheerness, there's more on the outside, right? There's not that many hospitals around. There's a lot of outside around, right? Lots of outside. And there's a lot of bugs and germs and fungus all on the outside. So by numbers alone, there's more outside. When you come to the hospital, not to visit, if you have to come to the hospital because you're sick, it's because you're sick. And people who are sick sometimes share infections. They'll cough or sneeze on each other, or heck, sometimes the nurses don't wash their hands or wipe the tables, and these little bugs and germs spread from patient to patient. And even though we try as hard as we possibly can to not let this happen, occasionally it does happen. Because the patients in the hospital are already sick, they're not healthy. So they are susceptible, meaning it's easier for them to get infections. So by number one, there's way more bacteria on the outside, but because we have sick patients in the hospital, it's much more dangerous for them because they're already sick. So we take a lot more care and caution, a lot more, we put a lot of work making sure that we don't spread infection. A lot more than you would at home, a lot more than you would even at school. Because at home and at school, you typically don't have really sick people. In the hospital, we do. The second question was about what happens if bacteria gets in the heart. It's a very good question. That's not where that's not a place where bacteria is allowed to be. Remember, there's only 2 times that bacteria really have cause disease. One, the first one is if bacteria gets in a place it shouldn't be, and the heart is definitely a place it shouldn't be. The really fancy medical word for that is something called endocarditis, which means inflammation of the inside of your heart. There's by a few different bacteria, and it's not very common, but it can cause a lot of really bad symptoms, really bad chest pain. Sometimes people will go to the dentist and they'll have their teeth cleaned at the dentist, right? You go, you have your teeth cleaned, they spray them all off, they scrape them. Some people take special medication called antibiotics because they have something in their heart, a murmur or a small hole in their heart that will let bacteria grow in there a little bit easier. So sometimes you may hear this, it's very common. Someone in your family might have this. When they have their teeth cleaned, they have to take antibiotic because of their heart. That's because they don't want bacteria to grow in the heart. So that's a very good question. Bacteria definitely shouldn't be in the heart. And we do a lot of work. Even if you just go to the dentist, sometimes they'll make sure that you get antibiotics so it doesn't happen. Outside of the dentist's office, you might not ever hear of bacteria growing in the heart unless you're in a hospital. Ms. Hockaday.
Okay, we have 2 students with 2 questions. Here's our first question.
Okay.
All right, hold on. All right, speak in here.
Can bad bacteria turn into good bacteria?
Good question. What's the second one?
And the other one is coming. Okay.
Why do doctors give kids flu shots if some people still get the flu?
Also a very good question. So the first question is, do bad bacteria, can they become good bacteria? And I say good and bad not because they have a moral compass. They don't know good from bad. It's just that some bacteria cause disease and some don't. And they don't really have a choice. It's just bacteria does. The bacteria doesn't choose whether to hurt someone or not. It just grows wherever it is. If it's inside of a person and it shouldn't be there, then it causes disease, and we try to kill it as humans because we value the human life obviously more than the bacteria. So I don't want to give the impression that the bacteria chooses whether it's good or bad bacteria. It just is. It just does whatever its genetic makeup tells it to do. If we find it in the human and it's causing a disease, then we get rid of it so that the human is not afflicted with the disease, so that they're not sick. So it's not good and bad as if it's a choice. It's just a good and bad as if whether it's causing disease or not. Now, could a bacteria that's causing a disease turn around and then stop causing the disease? Not in a human. Once it starts causing disease in you, it doesn't stop. Sometimes in the laboratories where they research all these bacteria and they try to change them and give them different factors, and they change what they give the bacteria to eat, and they change all of its environment, and they try to manipulate it, right? If you go to a big academic research institution and become a scientist, you could do this kind of stuff. Sometimes they can change what the bacteria does, but that's only that's in a laboratory, somewhere in a research institution. For most people, you don't go to those places, right? we've never been to one of those places.
Can a bacteria that causes disease be used for a good purpose elsewhere?
Ah, right. So the question is, can a bacteria that causes disease still be used for a good purpose? And the answer to that is yes. Right? We as humans can collect the bacteria without letting it infect us. We can collect it and study it and test what kind of drugs could kill it, or does it kill other bad things, right? We can do all these studies and find out how it works. Where did it come from? What is it, what can we use to kill it? What is it really good at killing? And we can use all that information. And in fact, we have used that information to help treat patients who are then sick. So yes, we as humans can use the information that we learn in that way, but the bacteria themselves, they don't choose like we choose whether to be good or bad. They don't choose. They just are. So if it infects a person, then we use the antibiotic to get rid of it so that they don't have the disease. And then the second question, sorry, the first question was good or bad, and the second question was, can you remind me again?
Oh, it's about flu shots.
Flu shot, that's right. Flu shots. So why does everyone get flu shots and then some people still get the flu? This is a little bit more complicated. So I'll try to keep it as simple. Do we have any understanding about viruses? Yes. Okay. So on the surface of the virus, on the surface, right, on the outside of the virus, there's different parts. So the vaccine connects to one of those parts, right? Kind of like Legos connect together, right? So we give you the vaccine, we give it in your body so that if the virus shows up, the vaccine will then help your body connect to the outside of the virus. Yeah? Sometimes the viruses, because they're tricky, they will change the outside of their parts. So even though we give you the vaccine, it's supposed to help your body recognize the outside of the virus. Sometimes the virus changes, right? It just changes a little bit on the outside. And because it changes a little bit on the outside, the vaccine we gave your body doesn't help your body recognize it as well. So even though you got the vaccine, you can still get a virus that causes infection. So every year when they make the vaccine, they try to predict what the outside of the virus is going to look like. And they make the vaccine so that your body will be able to recognize that. But if that year the virus looks a little bit different than the vaccine, you can still get the flu.
Ms. Black wanted to ask another vaccine question.
Okay.
About are there other ways to be vaccinated other than getting a shot?
Are there other ways? Yes, there are other ways to get vaccinated without getting a shot. Vaccines are just a way to help your body study ahead of time. That's all we're doing. We're trying to help your body study ahead of time so that it knows what the virus or the bacteria looks like, so that it knows if the real virus or the real bacteria shows up, your body can then fight it off much quicker. Is there a way to do that without giving you a shot? Yes, there is. And in fact, sometimes the flu virus can be vaccinated without using a shot. They use a little spray bottle and they put it in your nose and they spray it up in your nose, right? They'll call it, I believe they call it flu mist, something along these lines, a mist or a nasal spray. So there is another way to get the vaccine in your body. Not every vaccine is this way. And if there was a way to make vaccines out of pills or little nose squirts, then they would, because nobody likes shots. Nobody. Not adults, not little kids, not 4th and 5th graders, not high school students, college students, nobody. I don't even like shots, all right? So there it is, I said it. I don't even like shots, but there's no way around it.
The last thing about the flu was the question about what kind of bacteria causes flu.
What kind of bacteria causes the flu? That's actually a good question. Most times when people get the flu, they say, oh, I got the flu. It's not a bacteria, it's a virus, most times. There is a bacteria, and this is the confusing part, called influenza. And there have been times in the past where that bacteria spread and caused millions of people to die, right? This is the confusing part. Today, in the time that we live in, when people say I got the flu, it's almost always a virus. There is a bacteria, however, named influenza or flu. So it can be a little bit confusing if you're just reading about it.
That's Miss Black. She has a question. She had a couple.
Miss Black, do we have some more?
Can bacteria survive in hot water and oceans?
Yes. Can bacteria survive in hot water and in oceans? Yes, yes, they can. Not all bacteria. Some bacteria actually prefer warm water, not boiling, but warm. And some bacteria prefer salty environments. Not all bacteria, but some. So they can survive. It depends on the bacteria, whether it likes salt water, whether it likes warm or cold, you know, whether it likes to breathe oxygen or not. Every bacteria is a little bit different.
Payne had a foot question.
We have another, Ms. Payne.
Yes, they want to know how many years of school do you have to work in a blood lab and to become a doctor? I know there are different types of schoolings. Can you explain a little bit?
Sure. To get to work in the laboratory, to do the very basic things, doesn't require any schooling after high school, to do the very, very basic things. To do some of the chemical testing with some of the instruments that we saw in the laboratory, you need either a 2-year college degree or a 4-year college degree. And to do it all, you would need a 4-year college degree. In order to become a physician of any kind, whether like me or like any of the other physicians in the hospital, you have to get a 4-year college degree, followed by 4 years of medical school, which is then followed by somewhere between 3 and 7 years of additional training. So for myself, I had 4 years of undergrad, college, 4 years of medical school, 4 years of training with an additional 1 year of specialty training. So I had, after high school, 13 years.
They had another question about can athlete's foot spread beyond your foot?
Can athlete's foot spread beyond your foot? So athlete's foot is a fungus which infects your skin. If it's on your body, we call it something different. Like if it's on your, your stomach or your arm or your scalp, we use different names, but they're all fungus in your skin. And the medicines that we would use to treat it would all be medicines that kill fungus. So athlete's foot is a kind of a particular kind of fungus that likes dark, warm, and a little bit wet environments, which if your feet are sweaty, it's usually dark, warm, and a little bit wet. So if you're not cleaning your feet well, and you just wear the same socks for a few weeks at a time, and then most kids in high school, for instance, they'll go to they'll go to basketball practice or swimming or whatever sport they're in, and they go and they use the shower in the locker room and they walk out, and then the next person goes and uses the shower and they walk out, and the next person, and so every person's feet walks in and walks out, and the next person walks in and walks out. And so if one person has the fungus on their foot, then it'll spread to the next person because they walked in after the person with the fungus on their foot. So that's how athletes get athlete's foot, right? Because they typically share showers, right? And if one person has the fungus on the skin of their foot, it'll spread to the other athletes on their team in this way. That's not the only kind of skin infection. You can get little ringworms on your skin. It's the same thing. It's just a fungus in your skin. We call it something different, but it's a fungus in your skin is the same underlying problem.
It looks like all the questions have wrapped up, and we've got just a couple more minutes left. Is there anything here that you wanted to show them?
Do we have any other questions before we kind of give you the exit tour? No? I'll have them meet one or two of the techs out here and give them a short description of their educational experiences.
When are you guys supposed to receive your shipping?
Howdy. Hey, Bruce.
Yes, sir.
Can you introduce yourself real quick? It's 4th.
Very interesting. What does it take to work?
Okay, so like it's okay. My name is Bruce Joyce. I took 2 years of clinical laboratory technology. Okay, 2 years of school. Okay.
All right, everybody, this is Mr. Bruce. I don't know if they can hear you. Check, check. We hear it? Okay, good. All right, good. So he's going to help us understand what does it take to work in the laboratory. Mr. Bruce?
Yes, sir. And I got started a little late in life, so, you know, anybody can do it. You guys are young, and you shouldn't have a problem.
What did you do before the laboratory, Bruce?
I was a cabinet maker and a furniture builder. But then when the economy got bad, I decided I would go back to school. And it took 2 years, roughly 2 years, and I received an associate degree in the clinical laboratory technology. So that's what I am today, clinical laboratory technician.
And then after Bruce got to the laboratory, how long did it take before you felt comfortable? If you feel comfortable.
Well, yes, now I do. This is going on my 4th year. Yeah, you don't learn everything in school, so it took me, I would say, about 4 to 6 months to really begin to feel comfortable. But it's a good job. It's very fulfilling because you know you're helping someone. Whatever you do in this lab, most of the time you're helping someone else.
That's the reason why most of us get involved in the laboratory, is because we want to be able to help people. We don't always get to talk to them, but we know that the stuff that happens inside the laboratory is very important and will help determine what kind of medicine they get. So it's very important to have someone who is here because they want to help people. Do you have any questions for Mr. Bruce? We may not have enough time to generate questions.
Typically takes just a second.
Okay.
But then let me know.
Like,
Yeah, because they'll ask questions. Thank you, Mr. Bruce. Appreciate it.
You're quite welcome.
We're going to keep going this way. Thanks again. So this is back in our central area of the lab. So this is where we'll wrap up. Just kind of go over, just going to overview what we talked about. We started in the beginning, obviously, right, where patients come to the door. We'll draw their blood, or if someone's dropping it off, this is where we receive it. If we need to prepare the blood, we do it in this corner, in the big instruments that spin the blood, right, and divide it into different parts, the liquid part and the solid part. If we need to do chemical testing, we do that on this side over here on these two big instruments. These will test all kinds of different chemical aspects in your blood. If we need to look at the individual cells, we can put the blood on a slide and look at the microscope. If we need to test the coagulation, how well your blood clots, we can test that over here as well. If we need to test you for infectious diseases, right, we can do that a little bit right here. We have a very quick, very rapid strep throat test we can do over here. If the test that is ordered is so rare that we don't do it here. We can send it out. We can send it to a big lab that does that. And over here, where our tech, Martha, she's working on that right now. Hi, Martha. If we need to test your blood for what kind of type it is, or if you need a transfusion of blood so you can be given blood, if you donate blood, it goes to the blood bank. That's what we had in here. This is where we reviewed the different types of blood, A, B, and O. And then in the very back, which we won't go back to, is where we did the microbiology and the biopsies. So those are the main portions of our laboratory. If you go to a very big hospital, they might have a much bigger laboratory, but all of the same kinds of things happen there that happen here. So as we walk out, if there's any other follow-up questions, you can ask them now. How many patients do we see a day? Through our emergency department here can see somewhere between 60 and 100 patients in one day. And most of those patients will have some kind of blood work. Our hospital, the people who are admitted to our hospital, somewhere between 20 and 30. So on any given day, we might have 100 patients in the emergency department and maybe 20 to 30 in the hospital that are admitted and staying here for more than 2 days. So that's pretty average size, but it's nowhere as big as some place like Emory, or even in Athens at a place like Athens Regional. Those are much bigger hospitals that have hundreds and hundreds of patients in them at the same time. All right.
All right, guys, this is Mr. Bain. I'm going to unmute all you guys at once, and that way you can tell Dr. Lancia anything you might want to tell them for giving you the tour and answering your questions today and giving you access behind the scenes in the laboratory. So I'm going to unmute you in 3, 2, 1. All right. I hope you guys enjoyed the tour. If you have any follow-up questions, your teacher can email them to me, and I'll see if Dr. Lancia can send you a message back that way. Thank you, guys. Enjoyed it. We'll see you guys later. Bye.